Hello friends, and welcome back to my next video. Feeling extremely thirsty, fatigued and confused. This could be the sign of serious electrolyte imbalance, hypernatremia. But what exactly is hypernatremia? How does it affect our body? And what you do to prevent it? Let's break down it in simple terms. So if you have seen my previous video that is on hyponatremia, in that I have told you about the normal level of sodium. So sodium normal value is 135 to 145 milli equivalent per liter. So when we call it hypernatremia, so when the sodium level goes above 145 milli equivalent per liter is termed as hypernatremia. It may occur as a result of fluid deficit or sodium excess. So it sometimes frequently occurs with fluid imbalance, and it develops when an excess of sodium occurs without a proportional increase in the body fluid. Means only the sodium will increase but the water will remain same. And second is the when water loss occurs without proportional loss of sodium. Means water is going out of our body but sodium is there, so sodium is not going out with the water. So these are the two conditions when the patient can experience hypernatremia. Other risk factors for hypernatremia like excessive dietary or parenteral sodium intake, watery diarrhea, diabetes insipidus. This is the rare condition in that body will not be able to retain the water. So it will cause the excessive urination in the patient. Then damage to the third center, and the third center is the hypothalamus. And if the patient will have any physical or mental status compromise, then it can lead to hypothalamic dysfunction. That is because hypothalamus is the our third center. Now, what is the pathophysiology of hypernatremia? So when there is an increased sodium concentration in the extracellular fluid, there will be increase in the osmolarity, means solutes will increase, and solute is the sodium, so sodium will increase in the water. So then water will start leaving the cells by osmosis and enters into the extracellular compartment. So what will happen? Dilution of fluids in the extracellular fluid. Now the water that comes into the extracellular compartment, that would get diluted, and the cells, they will depleted for water, and patient will show the sign and symptoms. Other compensatory mechanism will be there, that is the suppression of the aldosterone secretion. And aldosterone, what it does, it again, it will, sodium is excreted in the urine. Normally what will happen, aldosterone will retain the water and sodium, reabsorb the water and sodium in the body. But when there is a suppression of aldosterone secretion, there will be increased sodium that will excreted in the urine. That is the one of the compensatory mechanism. So if we will see the signs and symptoms, that will be excessive thirst, dry sticky mucous membrane, firm rubbery tissue turgor, then manic excitement, patient will be so much happy. Then tachycardia, that is the increased heart rate, and death may also occur. So when we find out any patient with the hypernatremia, before management, we have to do the assessment. So if we will see the neurological system, in that we will see the spontaneous muscle twitching, irregular contractions, skeletal muscle weakness, and diminished deep tendon reflexes. Bicep, tricep reflex, bicep plantar reflex, all these reflexes will get diminished. In respiratory, we will see the pulmonary edema. In cardiovascular, we will see the diminished cardiac output. Heart rate and blood pressure will be also depend on the vascular volume. Then In genitourinary, there will be decreased urine output and increased urine specific gravity. In skin, patient will have the dry skin, edema that will be related to the fluid volume changes. Then interventions, what all things we can do to manage the hypernatremia. Drug therapy, in that lowering of serum sodium level by infusion of hypotonic electrolyte solution. So what this hypotonic solution does, it has the lesser amount of solutes. So what it does, it will send the water back to the intracellular fluid compartment. Then diuretics, they may also prescribed to treat sodium gain, so it can go out from the body. Then desmopressin, that is to treat the diabetes insipidus. As I said, diabetes insipidus, it is a condition that will retain the water and increase the, that will not helps to retain the water, allow body to retain water and increase the excessive urine and cause hypernatremia. And diet therapy, in mild we can ensure water intake. In nursing management, so nurse should always assess the abnormal loss of fluid, how the water is body is losing water, low water intake, or any sign of large gain of sodium, as sometimes it occurs with the over the counter medications that will have the high sodium content. Nurse should also obtain the medication history, because some prescribed medications can have the high sodium content. The nurse also note the patient thirst or elevated body temperature, evaluate it in relation to other clinical sign and symptoms. So this is how we have to manage the hypernatremia. So if you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical insights. If you have any question, drop it in the comment below. Thank you.